So basically, Aluna, we're launching a new blog series that features well-respected medical professionals where the focus is around sharing core conversations regarding remote patient monitoring and innovation. So we're very extremely happy to have you on for this series. And we'd
Thank you.
love to showcase you and Children's Hospital of LA with this interview on our blog and also our social platforms. We want to shed light on your amazing work. And of course, for people who will be reading this or watching this interview, Dr. Cam is a medical director at the Gore's Family Allergy Center at Children's Hospital of Ballet. He's attended the medical school at Northwestern University, Feinberg School of Medicine. He's also completed his fellowship at the Children's Hospital of Wisconsin and has board certifications from the American Board of Allergy and Immunology. So diving right into like some of the questions, what inspired you to become a doctor and why did you choose to specialize in allergy and immunology?
Yeah, I mean, I came to medicine actually pretty late. I think my parents had no idea that I wanted to be in medicine. I think I went to the University of Chicago for undergrad, and I was really looking for a passion, something to do. And I had always been sort of interested in sciences. My father was a bench researcher, and so I had been doing a lot of science-based things. And so I had that sort of interest in immunology and chemistry. And when it came down to it, I wanted to be around people and to help people. Like it was I was interested in the science, but I wasn't connecting with the work. And so medicine came up, and so I ended up going to medical school at Northwestern. And again, I think I was open to everything. I was open to all fields. I was open to, I was thinking about OB, and I was thinking about ER, like it was the whole spectrum. I think if you talk to my medical school classmates, they probably would tell you that they knew that I was going into pediatrics from day one, but maybe I was lying to myself, but I didn't know. But over time, what I found was the problems that interest me, the patients that interested me most were pediatric patients, kids, and the reason is, one, I think I connect with them on a very simple level. I like kid things, cartoons, video games, that sort of thing. So I always have someone to talk to in clinic. But then the other piece is that you're getting patients that are interested in getting better and interested in being well, right? And so and kids can get better. That's the other thing. Like, so you can have an impact on somebody's health early and have a long-lasting effect. And that was meaningful to me. And so that's why I went to pediatrics. And then why allergy immunology. There are a lot of things. The first thing is I mentioned I had an interest in immunology and sort of the fundamentals of that disease, those disease processes. But then immunology and allergy has such a variety of disease processes and ways to help kids. So you get things that are very esoteric, right? So you get things like immune deficiency, the sort of the zebras of the medical field. But then you also get things that affect, patients very commonly. And, we're talking 20% of the population with things like allergic rhinitis, 10 to 12% of kids with asthma. And so now you're dealing with things that not only affect a lot of people, but also affect them through time. And so like being able to help somebody throughout sort of their entire life was also very appealing to me. And so, those are some of the things that really led to my decision to go into allergy immunology.
Okay, thanks for sharing. And so digital health solutions and also remote patient monitoring can help improve health by driving patient adherence and self-management while cutting costs. So in your opinion, what patient demographics are best suited for using digital health solutions?
I mean, I think that you bring up a really great point, and that is sort of the holy grail of medicine in general is, one, patient-centered care, but also precision medicine, like not only being able to find the right treatment for the individual patient, but also tailoring that treatment for that patient, right? Not just a disease process or whatever, but that individual person. And so, there are lots of ways of approaching that. In allergy immunology, obviously there are things like these precision biologic medicines where we're looking at specific disease processes and targeting precise cytokines. But the other end of that is meeting patients where they are, right? Like going into their homes and using technology to improve their care on an individual level. And things like remote patient monitoring are ways to get at that. And so the question is like, who is best for it? Well, ideally it would be, everyone, right? And like, it's sort of like reducing friction for the use of these sort of technologies. But in sort of that first wave, I think there are two categories of people that I think are best targeted. One is the difficult to treat patient. So somebody that has not difficult to treat, but difficult to control. Sorry. So let's use asthma as an example, where you have a patient that, despite your best efforts, you put them on all the medicines you can. You're ramping up their care. You're teaching them everything that you know, and despite that, you're still having difficulty controlling their asthma. Well, something like remote patient monitoring would be ideal for that patient, because then you can intervene sooner. Then you can potentially find where sort of their points of friction are and sort of address the problems that you're not thinking about. And so that's the first use case that I would think of. And then the other one is patients with that either they want to know about themselves, so they are interested in their own sort of disease process, and so this is something that can feed back onto their self-care. And so I think there are lots of other patients, patients interested just in technology, just data, people that are just data crazy, right? The people that like to log their daily activities. I think all these types of users, I think remote patient monitoring would be useful for.
Okay. And so the Gore Family Allergy Center also delivers the highest quality patient-centered care and clinical services, including digital health solutions or respiratory care. So what advice would you offer a physician that wants to start implementing digital health solutions into their practice?
I think that, going back to the last question, patient selection is at this point still important. And here, I think you need to find motivated patients, and then patients that understand the use of technology. Everybody has a smartphone, but not everybody sort of interacts with it the same way. And so, when talking to families, you can always get a sense of the kids that would just want to play with a piece of tech, or are interested in interacting with the phone in a way outside of just texting and gaming, right? And so that sort of patient selection, at least in the beginning, is important. And then the other thing is understanding how these digital solutions will work in your workflow and improve the patient care. So, like, I think each provider has to look at their workflow and how they interact with technology, and how that taking a new piece of technology will improve their flow with the patient. And I certainly think that Aluna has been thinking about the user interface, both for the patient and for the physician, when designing the sort of how we interact both with the technology and with the patient and their technology. So.
Okay. And so based on your knowledge in medicine for the last 9 years, and even beyond that, how do you think the use of digital health solutions will evolve respiratory healthcare space in the next 5 years?
So, I mean, I think that this, everything, obviously the pandemic aside, everything has been, other than the big 2-year gap that we have from the pandemic, everything's been moving pretty quickly. And I think that respiratory health technologies are about to take a leap, because certainly we've been sort of stagnant for a very long time, office use of spirometry, these sorts of things. But looking at what Teva did with their DigiHaler and what like home spirometers like your device, and newer technologies that are sort of trying to take a leap, like oscillometry, are really starting to evolve and move forward. And so I think that respiratory, like the need for more data and more usable data is clear, and sort of helping delineate patients is really the piece that we need, right? Like we need to be able to know which patients and how to treat those patients, like how, like, do they fit into different categories? So for the longest time, everybody's just had asthma. It's been just sort of a broad brush. With some of these new technologies and ways to sort of biomark patients and things like that, I think we're going to be able to better differentiate patient and patient diseases, and then be able to treat them better. And so I think in the next 5 years, I think we're going to see an improvement of care, because they're going to be implementation of these technologies will help sort of delineate which patients need what care. Yeah.
Perfect. Jason, would you like to ask any other questions?
Absolutely. So thank you, Dr. Tam, for your thoughtful answers. We're obviously very excited that Children's Hospital of LA, has and is using Aluna. But taking a couple steps back, what did intrigue you, interest you about partnering and offering Aluna as an RPM device for your patients?
Going back to that sort of idea of a company that thinks about the user experience, and obviously nothing is ever perfect, but I think that was really the most important thing. What is the user experience for my patients, and are they going to use this device? Because, for the longest time, we had things like peak flow meters to look at home lung function, right? And I personally really haven't been a fan of peak flows, because nobody ever does a peak flow. They just don't do it, right? You can give out a peak flow in clinic, but what is the percentage of patients that will use a peak flow? I don't know. It's in the single digits probably, right? And so, how do we incentivize patients to use a piece of technology that we want them to? And I think gamification is sort of the answer, right? Gamification is sort of it's what kids and myself, are interested in, right? Like that feedback loop of doing something and getting a little reward, and then doing it again and getting a little reward, is addictive, right? But it's also helpful as motivation. And so I think when I first saw the Aluna device, I was like, oh, that's cool. It's a very small spirometer. And I wasn't moved. I honestly wasn't moved. But when I saw the app, I was like, okay, well, now I understand how we're going to make this work, right? How are we going to get people to use this device? And that's the flip, right? That's where you start thinking, okay, well, if it's fun enough, and your doctor tells you to do it, and there's a mini reward system, well, then we have a chance of getting this information. And so I think that's the biggest piece, is how do we convince patients that, one, this is an important piece of information, but then how do we keep them using it when they bring it home, right?
Absolutely. So to piggyback off of that point, right? So obviously Aluna, or RPM in general, relatively new in the respiratory space. how do you communicate the value, right, of the device to a parent, to a child, of like, why is this beneficial? I guess like, how do you think about positioning it to, potential patient that has never used one before?
Yeah, I mean, so I think the piece has actually become easier in some ways because of COVID. So we always ran into this problem in clinic because we have insurance is always an issue. We have to get approval for things like spirometry. But then COVID hit. So, there was always that barrier where I was like, okay, I want to do lung function, but we got to get approval from your insurance, this sort of thing. And so, sometimes we wouldn't get it as frequently as we wanted to, and I wasn't getting this data. And so parents would always be like, are we getting that lung function test today? And I'd be like, double check. Oh no, your insurance didn't approve it. And so there's this thing like, okay, now I don't have to ask for this approval from, the insurance. So there's that piece of it. And then the other piece is that with COVID, spirometry is considered a aerosol producing procedure. And so then a lot of places, including here at Children's Hospital, we stopped doing routine spirometry unless you were tested prior. And so that was another point of friction where we were like, okay, there's this information that we want and we can't get it because, they didn't come in to get tested on time. They didn't, and so sort of, saying like, look, we want this information, but, there are these barriers, but if you use this device, that barrier is gone. You're doing it at home. We don't have to worry about COVID. And then the other piece is like, I see you at one point in time, you're telling, I rarely get to see you when you're really sick. I would like to have this information when you're sick, and patients intuitively understand that, right? Like they understand that, like, sure, I only come in once every 4 months, or whatever. And you get a picture, but you're not getting the full picture. So if I could do it when I'm not feeling well, they get that, and so you're saying like, you explain the test, it's the same test. And so you're giving it to them when they understand it would be most useful.
Absolutely. And thank you for that. And just to piggyback off, this is the last question, but to piggyback off of even that last answer, like, so, you brought up a great point, right? Some patients, when they're healthy, they feel great. Maybe they don't take their controller, maybe they don't use Aluna. But when you identify a patient, maybe their FEV1's dropping with the device, like what type of things can you do with the data from, using an RPM device, such as like an Aluna, to prevent a health crisis? Like, what are the things you can do to intervene?
Right. I mean, I think the first thing is just use of rescue controllers. A lot of people struggle with just the use of when to use their rescue inhaler. There are patients that are, what we call, low symptom perceivers, right? So they don't even know that they're starting exacerbation, right? And so having something like this would help them identify when they can, start using their rescue medications to head off an exacerbation. The other thing would be, parents who, maybe they're worried about overuse of the medication or when to use the medication. And so something like this can help trigger them to be like, okay, oh, now he's coughing. Oh, his lung function is down as well. This is the time the doctor told me, I should be aggressive with the rescue inhaler medication. And then, especially in a time like this where people are hesitant to come into a healthcare setting, you can do some sort of more remote sort of care where you're like, okay, your FEV1 is down, and you have some symptoms. Here's a watch and wait prescription for steroids or something, that sort of thing. You're hoping that you can head off that thing, but all that information is giving you sort of early warning signs for use of medication so that hopefully you don't get to the point where they need the steroids. Yeah.
Excellent point. Amazing. Well, thank you so much, Dr. Tam. That's all the questions I have. So it's so informative to kind of hear from you. And yeah, thank you so much.